Welcome to Maryland Health Today. Many people suffer from nerve disorders that cause pain or severe weakness. These include muscular dystrophy, shingles, trigeminal neuralgia, diabetes, and other conditions. We'll learn more about diagnosing and treating these problems on the show today. My guest is Dr. Neil Porter. He's a neurologist at the University of Maryland Medical Center who specializes in neuromuscular disorders. And Dr. Porter is also an assistant professor of neurology at the University of Maryland School of Medicine. Welcome to the show.
Pleased to be here.
What is a neuromuscular specialist, first of all? What do you do?
Yes, a neuromuscular specialist is a neurologist who sees patients with various disorders of either of the muscle or of the nerve. So of the muscle, such as muscle inflammation, or muscle degeneration, such as muscular dystrophy, or disorders of the nerve, such as what we call peripheral neuropathy, or compressive neuropathy, such as carpal tunnel syndrome.
What is the role of nerves in our body?
Right. Nerves actually are useful for controlling just about every function that you can think of, either for allow you to move or allow you to feel. So all those functions are subserved by nerves.
Let's first talk about muscular dystrophy. It's a problem that many of us have heard about because of the annual telethon, but I don't think a lot of people really know what it is. So could you tell us a little bit about it? How common is it, and what is it really all about?
Sure. Muscular dystrophy is a term that's actually used for a set of disorders, so it's not actually one specific disease. It's actually a number of different disorders, but with some common characteristics. Muscular dystrophy is a hereditary muscle disorder that's degenerative, so that you actually have a loss of muscle function. You actually have a loss of muscle over time. And this set of disorders is actually caused by various genetic problems. So usually if you have a loss of some chemical or protein in your body that's responsible for muscle function, then the muscle will actually break down over time, and then that will lead to these manifestations that we think of as being muscular dystrophy.
Does it usually develop in childhood?
There are different forms, so that some forms actually do develop in adulthood. Other forms can develop during childhood, and then there's actually some forms that do manifest in infancy. So there's a wide spectrum of time for manifestation for the different forms of muscular dystrophy.
And do some people have a very severe case while others have a mild case that doesn't affect their life a whole lot?
Yes, I mean there are some forms that really don't affect their people's lifespan, and then there are other forms that actually can shorten people's lifespan dramatically. And a lot of the people that you see on the telethon actually have a form called Duchenne muscular dystrophy, and usually it's a disorder that affects boys. That's a disorder where people usually succumb by age 20 or 30.
Oh my goodness. Well, what are the symptoms of muscular dystrophy?
Yes, so people with muscular dystrophy will usually have some combination of progressive weakness, muscle loss, which then leads to eventually to difficulty breathing and difficulty swallowing. People oftentimes will have secondary bony disorders such as scoliosis or curvature of the spine. But again, it's a progressive disorder leading to problems over time.
Are there some effective treatments? Are there some medicines that work to relieve the symptoms or even slow the progression of the disease?
Most of the forms of muscular dystrophy really don't have a cure or even an effective treatment, unfortunately, at present, at least a medical treatment, say a pill that you can take. One form, Duchenne muscular dystrophy, again the most common form of muscular dystrophy, does at least have a treatment, and that's steroids or prednisone that children can take to help slow the progression. But most of the other forms don't really have any medicine that people can use. So we have to use what we call non-pharmacological measures, meaning something other than pills to help people.
Would that be physical therapy or exercise?
Exactly. So we try to use measures that are going to help people maintain their function or keep from losing function, and that is going to be things like physical therapy or splints or braces for, again, this curvature of the spine or scoliosis, again, to try to keep people as functional as possible for as long as possible.
Could you tell us a little bit about the interaction between the nervous system and the muscles? Because you've been talking a lot about the muscles degenerating in muscular dystrophy. And what's sort of the relationship? Why is it a neuromuscular disease?
Right. It's partly tradition that muscle disorders are taken care of by neurologists. Again, the muscles are controlled by the nerves, and there's actually a connection called the neuromuscular junction in between. But the nerves that control the muscles, the connection between the nerve and muscle, which is called the neuromuscular junction, and then the muscle themselves actually comprise a functional unit. And as neurologists, we take care of the whole person, but we also take care of the people's problems with this functional unit of this nerve and muscle.
That's interesting, because I never thought of nerves as being involved with muscles. You know, you think about working out and building up your muscles and so forth, and didn't realize that there were nerves that were sort of part of this whole thing.
Well, you can't move without the nerves. The nerves actually serve to control the muscles, but it's really the brain. The nerves are the connection between the brain and the muscle. So the way you can move is to have your brain tell your muscles to move, but that's going to happen via the nerves.
Is there some good research going on now for people who have muscular dystrophy? Is there something promising on the horizon?
Well, the Muscular Dystrophy Association, as well as the National Institutes of Health and a number of other private organizations, are funding a number of programs. So it's a very active area of research, and there are many people who are highly motivated to see progress made in this area. Unfortunately, the progress, as in many areas of science, is relatively slow. So even when we learn new facts, that it takes a while for that to translate into treatment plans.
Sure, and I guess the basic challenge is understanding what's happening and what causes these things to go wrong, right?
Exactly. So our understanding is really going to be crucial to finding effective treatments, but that's not really enough. It's going to be a matter of really finding either specific medications or specific treatment options that will really help people.
Another disorder that you help people with is called myasthenia gravis.
Right.
What is that? Is that kind of rare?
Myasthenia gravis is relatively rare, so many people, as opposed to hearing about muscular dystrophy, may not have heard of myasthenia gravis. And the way I try to tell people is myasthenia gravis is similar to lupus in that it's what we call an autoimmune disorder, whereby the body actually attacks itself. In this case, in the case of myasthenia gravis, the body attacks that interface between the nerve and the muscle so that you don't get the normal communication and the normal control of the muscle that normally the nerve provides.
And does this affect women more than men?
Most autoimmune disorders do affect women more than men, and it's usually, say, relatively young women or middle-aged women that are affected most. As people get older, both sexes are affected more equally.
When do the symptoms begin?
Myasthenia gravis can affect people at any age, but as I said, mostly it's middle-aged women that are going to be mostly affected. But it can manifest itself even in infancy, interestingly enough.
What are some of the symptoms that people will have?
Sure. Myasthenia gravis can be very, very difficult to diagnose because some of the symptoms are actually relatively common. Fatigue is a very prominent manifestation of myasthenia gravis, as is fluctuating weakness. Double vision, which isn't very common, so that's very helpful for us. Droopy eyelids, which is not very common in the general population.
Unless you've been getting too many Botox
yes,
injections
exactly,
in your forehead, right?
Exactly. And swallowing problems and breathing problems. And those are the problems that really pose the most dangerous symptoms to the patient, meaning those things are going to get patients into trouble. And that's what I, as a neurologist, have to pay the most attention to.
Do some people with myasthenia gravis go without a proper diagnosis for a while because they may be misdiagnosed as having chronic fatigue syndrome or something like that?
Exactly. Myasthenia gravis is so rare that usually people will be given diagnoses of disorders that are a lot more common. And since a patient with myasthenia can look normal during their good times, then it may be very difficult for any physician, including a neuromuscular specialist, to make the diagnosis.
Well, how do you diagnose it? What are some of the tests that you do and that sort of thing?
There are a number of ways to diagnose myasthenia gravis. The most reliable, well, one of the most valuable ways is just by, again, looking at the patient and talking to the patient, so what we call the clinical impression. But in addition to that, there's actually some laboratory tests that we can do. So there are blood tests, which are very reliable. And then there's actually electrical testing that we can do where we do actual nerve stimulation to try to see how the nerves are working, to see whether they're working normally.
Right, and I guess here we see you performing this test on somebody, and what is that? What are you doing there?
Well, yes, what I'm doing here is actually using what we call an electrical stimulator, and some people liken it to a cattle prod.
Oh, that's lovely.
Yes, to stimulate, and again we say stimulate, but as a term to just mean shock the various nerves to see if we can get a response from those nerves.
I just saw her muscle jumping there.
Yes, so and that's the normal response is going to be that we shock the nerves to then stimulate the muscle and then to produce a response, and we see whether that's a normal response or an abnormal response.
Right, there with the foot. And then, so you get a readout that tells you if
how the nerve is working, and what we do is we compare the results from any given patient to a standard set of normal values, again, to see how the patient's response compares to the response of our normal population.
Is there any good way to treat myasthenia gravis?
As the name implies, myasthenia gravis can be a very serious condition, and in the past was very grave, meaning where the
Is that
term
why it's gravis?
Gravis originated from. But now we actually have a number of very good treatments for myasthenia gravis, so people can really live relatively normal lives often, although at times it can be very difficult to get their condition under control. These days we have such a varied armamentarium of medications that usually people do actually fine these days, but in the past it was much more challenging to treat people with myasthenia gravis.
Where does the word myasthenia come from?
Oh, that's a good one. Boy, you're really challenging me with my
Sorry.
Latin there. Boy, I can tell you the gravis part, but I can't tell you where the part of the. I'm ashamed to say I can't tell you the origin
well, I'm sorry,
of the
that was
myasthenia.
unfair of me to just throw that at you, but
That's
because
fine.
I know that you treat so many different conditions, and many of them, it seems, in the neurological realm have some very interesting names and so forth.
Well, I guess the more I think about it, asthenia really refers to almost like a listlessness, I guess is my impression. So myasthenia, meaning more muscle listlessness, so myo, meaning muscle. So it really probably derives from a feeling of this fatigue, almost like a malaise of feeling blasé, that fatigue that really probably, in all likelihood, was the source for that term.
Oh, okay. Again, I didn't mean to throw you off with that. But autoimmune diseases are really puzzling, aren't they? Because it's the body attacking itself in some way.
Right. And as a neuromuscular specialist, I actually see a number of people with autoimmune disorders, meaning that some of the nerve disorders are autoimmune. Clearly, there are muscle disorders, such as polymyositis, that's autoimmune. So that really does represent at least a cadre of at least difficult to treat patients. These are usually serious conditions, and they require serious treatments. So that it really is challenging for myself, but it really is also rewarding when people do well, because these conditions can be very dangerous and very debilitating. So to see people do well is very heartening.
I'm sure. Well, we have to take a break, but when we come back, we'll talk with Dr. Porter about some nerve disorders that cause pain and how to treat them. So stay with us. We'll be right back.